Good afternoon. So my talk will focus more on children growing up under medical risk. Now, I picked on HIV specifically because it's quite a common condition right now, but also it provides a really good model to see how a medical risk factor works alongside other psychosocial issues to impact on development. So I think many of the lessons we learn from here can be translated to other children living under chronic stress and conditions. So I'll focus more on HIV in Africa. Africa carries the largest burden of childhood HIV. 90% of the children who are actually infected are from sub-Saharan Africa. Now, the important thing is that the 90% is 2.3 million. But there are 16 million children who have been orphaned because of HIV. And there are 60 to 90 million children who are living in the context of parental or caregiver HIV illness. Now, an important thing here is I've used caregiver because these children are not necessarily being brought up by their parents. Yeah? So the focus is how is the caregiving context influencing their outcome. Now, there is actually an article out there saying the challenges of success. So the introduction of antiretrovirals has been successful. It has improved. It has decreased mortality. We have children living longer, which is good news. But these children now need to thrive. They just don't need to survive. They need to achieve their potential. But the other part of it is that we also have adults living longer, meaning more and more children will live in home states where either the parent or caregiver is chronically ill. Now, what's the evidence on the developmental impact of HIV? From Africa, what we know is that children who are HIV positive compared to their peers lag behind in multiple developmental areas, be it cognition, be it behavioral issues, educational outcomes. They are much behind, even in the context of ARVs. So even when they've been introduced to education, to medication, and they have stabilized. Actually, in one of the studies we've just finished, one HIV-positive adolescent told us, well, the virus put him down for 3 or 4 years when he couldn't go to school, but the fact that the education system does not accommodate him after being sick for 5 years is what is ruining his life. So now the kids are surviving, but we don't have policies, we don't have programs to keep them in schools. But other than the infected children, the largest group of children who are actually impacted on by HIV are children who are living in homes or families where one of the caregivers is unwell. And what the research on this shows is that they show various forms of neurocognitive delays. They're not sick themselves, they have mental health problems, and they're lagging behind in educational outcomes. Now, one of the recent systematic reviews, found that actually the impact on HIV-affected children is more pronounced in resource-constrained settings, which already gives an indication that it has to do with the amount of resources that these children are able to access. Now, what leads to poor outcome? Let's just say up front, it's multiple pathways to poor outcome, yeah? But I'm going to focus on the caregivers and the caregiving environment because this is a micro-contextual factor, It's likely to have a stronger influence on child development, and we already know there are some programs on how we can intervene. Now, very briefly, what is the caregiving context for children who are either HIV infected or who are living in homes where one of the caregivers is HIV infected? There is parental illness. There is evidence to show that sometimes children, even as young as 8 years, have to take up the role of carers for ill parents. One of the recent findings in Africa is that there's been quite a long traditional strong social support. But in certain communities, HIV has had such a strong impact, leading to the destruction of the usual social support systems. Because if you have all the adults dying or are unwell, then there is no one to take up children or to foster them. Then there is, of course, orphanhood. There is the very serious problem of caregiver mental health problems. Among adults living with HIV, we find that there is very high rates of depression and anxiety. Actually, in our recent study, it's not yet published, among caregivers of adolescents who are HIV positive and also HIV affected, those caregivers, even when themselves they are not infected, they report very high levels of distress. This might have to do with stigma, but also poverty. So there shouldn't be any misunderstanding. HIV is not a disease of the poor. Yeah? But when a family is affected by HIV, they are likely to be, their socioeconomic status will be affected. So if the caregiver is constantly unwell and not able to participate, there is medication. Medication goes with the need to have good nutrition. So all these are really extra stressors on the caregiving context. So what is the impact of these stressors? So maybe I can just start on by looking at one example of a study. Actually, I think it's the only study I could identify on 1 to 5 years in Africa. So there are other studies on older children on the caregiving context, but in the younger years, there's hardly been any studies. And they looked at the quality of the home environment, the child's behavior, the caregiver, depression and anxiety levels, and SES. And what they found, I just pulled out this graph that shows the results, really is the fact that the caregiving context is very much compromised, and that compromise of the caregiving environment leads to high rates of behavioral problems. So they correlated caregiver anxiety and caregiver depression to high rates of internalizing problems among the children. Now, so I just mentioned that there's really very limited information among the preschoolers. I think a lot more can be done in terms of trying to understand what's the impact of the caregiving environment on preschooler outcomes. However, among older children, and we have no reason to believe that if the caregiving environment impacts negatively on adolescents and school-going children, it wouldn't impact on younger kids. There's quite a convergence of evidence that what happens is that the caregivers of HIV-infected children are likely to be more poor, to have less economically compared to their peers in the same community. They're likely to report higher depressive symptoms. And what this does is that it impacts negatively on the way the parenting behavior, the opportunities they avail to their children, and this impacts negatively on cognitive development, educational outcomes, and access to other facilities. So what can we do to enhance developmental outcomes in this context? There is quite a very detailed review, systematic review on this, and the evidence really is that there is so little data on what can be done. Hardly any intervention studies, so there is a very small evidence base, but what we do have is a lot of background literature from early childhood development on how do you intervene in the context where the caregiving environment is compromised. Now, the core issue is that, one, you need to look at modifiable risk factors. For instance, we've said that among HIV-infected and HIV-affected children, their parents or their caregivers are likely to have mental health problems. Yeah? So, and we've had evidence from Rahman that we can deal with mental health problems using simple, community-based approaches. Yeah? Actually, in Kenya, with HIV, one of the ways in which they've been able to reach families is to use community health workers. But most of these community health workers are not trained to deal with mental health issues. So that is a good approach to do it, to reach these families, to also train these community health workers to address issues of mental health. But there's also need, what most people think is in terms of how do you deal with risk. But there's also the issue of providing protective environment. When you remove a risk, it doesn't necessarily mean that you'll improve outcome. So for instance, parents might find it very difficult to care for their children because of poverty. But we also know that within these communities where parents are not doing very well economically, there are parents who are able to bring up their children to thrive. So we need to look at what are some of the factors that make parents within this community, within this context, to make their children thrive that other parents don't practice, and that can be implemented. So that's what we mean by not only dealing with the risk, but also in doing what? Introducing protective environments. Now, so I just made this based on the evidence from early early childhood development. There's at least 1, 2, 3, 4, 5. My arithmetics is a bit misplaced. So there are 5 potential areas based on what impacts on HIV-affected children and what is the evidence there on what we can do. So there is the mental health care. I think that's come out very strongly in the HIV, literature, and we know that there is evidence it can be implemented at a very low cost. There's the issue of economic empowerment. I mean, that is something people tend to, we need everyone to stop being poor. It's just not healthy. I'm not sure how. But also there's the issue of providing stable and quality care. I was reading the literature on this yesterday, yeah? So there's the debate on children should not be removed from their kinship. It's best that they stay within families, within support systems that work for them. Then there's also literature that says it's not so much as where they are placed, but the ability of the person caring for them to give them quality care. Yeah? So if we insist, for instance, they should stay maybe in a situation where the quality of care, it's kinship, but there's not enough resources to care for them, that might not be optimal. There's psychosocial support for families. This is actually so important, at least from the Kenyan context, when you're talking about HIV-affected families. So like in Kenya, HIV-infected children are put through the comprehensive care system, and there is some sort of support system. But what happens is that if a mother is found HIV positive, the whole family is tested, and any child who is not infected is released from care. So no follow-up is carried out, and yet there is a lot of evidence to show that mental health, especially mental health and educational outcomes, are adversely affected among HIV-affected children. So there are only 2 studies from Africa, at least I could identify, that have looked at interventions. How can they intervene to help children and families impacted on by HIV? And there is one on psychosocial stimulation. It was a very low-key thing that used people who have been trained to administer it, but they originally had very limited training, and they worked with families. What happened is that they had simple play with mothers, and they taught mothers to do this with their children. And the results is that it enhanced developmental outcomes among children, but also what they thought really worked is that it was seen to be an integral part of the care, their health care. So it was not like something new you are introducing. You are here for care, and this is part of the care. So it really emphasizes the need to include this within existing frameworks. The other one is MISC. I won't go into details about this, but also this included working between community health workers and parents, and not only did it improve developmental outcomes, but it improved mental health of the caregivers. Okay? And they looked and improved parenting practices. So parents were more sensitive to the needs of their children. So in conclusion, what I can say is that what has been observed is that while HIV as a virus for children will impact on their nervous system, leading to definite delay, HIV also impacts on the caregiving context and the home environment, playing a crucial role on outcome. And what needs to be done, I think, is that quality of care is really compromised when the caregiver is not doing well, whether mentally, physically, economically, yeah? So what we need is investments that enhance the conditions of the caregivers. We cannot enhance the child's condition if the caregiver is not doing well themselves. Thank you very much.
Thank you so much, Amina. We cannot enhance the child without enhancing the condition of the caregiver. A great summary. And now we're going to hear from Leah Fernald at the University of California at Berkeley.